Let's be honest, getting a handle on rheumatic disease can feel, well, pretty overwhelming. So in this explainer, we're going to cut through all that noise. We're going to map out a clear path, starting with those very first symptoms and taking you all the way to a smart, effective plan for managing it.
You know the feeling. It often starts just like this. You wake up and your joints are stiff, swollen, and just plain painful. And it's not the kind of stiffness that goes away in a few minutes. It can last for what feels like forever. This isn't just a random ache. It's your body sending a pretty loud signal that something bigger is going on.
So what are we really dealing with here? Rheumatic disease is actually this huge umbrella term. I mean, it covers more than 200 different conditions. They all mess with our joints, bones, and muscles. But for a lot of them, like rheumatoid arthritis, the real kicker is that they're autoimmune. And that just means your body's own defense system gets its wires crossed and starts attacking healthy parts of you.
So think of it like this. Your immune system is supposed to be your body's security team, right? Protecting you from invaders like germs and viruses. But with an autoimmune disease, that security system goes completely haywire. It's like the alarm is blaring 24/7, and it starts mistaking your own healthy joints for the bad guys and, well, it launches a full-on attack.
Okay, and this is a really important point we have to make. A lot of people hear arthritis, and they immediately think of osteoarthritis. You know, the wear and tear kind that happens over many years. But inflammatory arthritis, like RA, is a totally different beast. This isn't about getting older or overusing your joints. It's about that internal autoimmune attack we were just talking about, which is why it can show up at any age.
All right, so you've got these symptoms. How do doctors actually figure out what's going on? Well, it's like a real investigation. It's a careful process, a bit like detective work, all designed to find the real culprit behind all that pain and inflammation.
You know, getting diagnosed isn't usually some big aha moment from a single test. It's really a journey down a path. It all starts with your story, what you're feeling, your medical history, what runs in your family. Then comes a really thorough physical exam. And after that, we get into specific lab work and imaging, like x-rays. Every single step adds another crucial piece to the puzzle.
During that physical exam, a rheumatologist is hunting for very specific clues. They're not just looking for any old swelling. They're feeling for something called synovitis. It's this specific kind of soft, almost boggy feel over the joint. And in some cases, like with psoriatic arthritis, they might see something called dactylitis, where a whole finger or toe swells up, which is how it got the lovely nickname sausage digit. Blood tests let us peek under the hood at what the immune system is actually doing. We're looking for these things called autoantibodies. Now, there's a classic test called rheumatoid factor, or RF, which can be a hint, but honestly, it's not super specific. The real game changer is a test for something called anti-CCP antibodies. If that comes back positive, it's one of the strongest clues we have that RA is what we're dealing with.
So, as soon as that diagnosis is confirmed, the focus flips immediately to action. The way we treat these conditions now isn't about passively managing pain. No, it's proactive, it's goal-oriented, and the whole point is to stop the disease in its tracks.
And the goal here is way bigger than just making the pain go away. It's really about three key things. First, get the symptoms under control so you can just feel better every day. Second, and this is huge, prevent permanent damage to the joints. And third, the ultimate goal is to help you live your life to the fullest, to be as active as you want to be. Today, the name of the game is a strategy called treat to target. What that means is you and your doctor work together to set a very specific goal. Ideally, that goal is remission, which means basically no signs of the disease being active, or at the very least, getting to a state of low disease activity. Then you're monitored all the time and your treatment gets tweaked until you hit that target. It's a true partnership. So, what do we have in our arsenal to hit that target? Let's open up the toolkit and get to know the main medications. These are the tools you'll use to fight back against the disease. Okay, the absolute cornerstone of treatment are drugs called DMARDs. That stands for disease-modifying anti-rheumatic drugs. And really, the name says it all. These aren't just for symptoms. They actually modify the disease. They go right to the root of the problem and calm down that overactive immune system to stop it from causing permanent damage. And this whole family of drugs has really come a long way.
For years, the foundation was what we now call conventional DMARDs, and the classic example is methotrexate. Then things got really exciting with the arrival of biologics. These are super-targeted therapies like adalimumab. And now, we have even newer options called targeted synthetic DMARDs, which are pills that also zero in on very specific parts of that haywire immune response.
Let's zoom in on methotrexate for a sec, because it's so often where treatment begins. It's a simple once-a-week pill that does a fantastic job of knocking down both the inflammation and the long-term damage. But here is the most important part. It's almost always taken with folic acid, and taking that supplement is absolutely crucial for heading off potential side effects like nausea.
All right, next up are the biologics. These were a massive leap forward. A drug like Bimzelx is a perfect example. It's engineered in a lab to find and block one very specific little molecule that's fueling all that inflammation. They're so precise they can be used for related conditions like psoriatic arthritis, too. And because they're these complex proteins, they can't be taken as a pill, so they're given as an injection or an IV infusion.
Now, I know the idea of giving yourself a shot can sound intimidating, but I promise it's a very straightforward process once you get the hang of it. It all boils down to a simple routine. Get the drug ready, get yourself ready, and get the spot ready. Your nurse will walk you through it step by step. The two biggest things to remember are to always switch up where you do the injection and to always get rid of the needle safely in a proper sharps container.
So a question we hear all the time is, hey, why can't I just pop an ibuprofen? And look, drugs like ibuprofen, the NSAIDs, they're great for making you feel better right now. But, and this is a big but, they don't stop the disease from getting worse. Only the DMARDs do that. The best way to think about it is this. NSAIDs are the firefighters putting out the little fires you can see. DMARDs are the crew that comes in to fix the faulty wiring so the fires don't start in the first place. But here's the thing. Treatment is so much more than just what's in your medicine cabinet. If you really want to live well with a rheumatic disease, you have to look at the whole picture. So let's talk about the other strategies that really empower you to take back control.
This is exactly why looking at that whole picture is so vital. See, the inflammation from a disease like RA doesn't just hang out in the joints. It can affect your entire body. And that, unfortunately, raises the risk for other conditions, what doctors call comorbidities, things like depression or even heart problems. It just goes to show why you need a whole team, not just a rheumatologist, looking after your overall health.
Besides your medications, there are these simple but incredibly powerful things you can do every single day to protect your joints. The number one rule: respect pain. If something hurts, listen to your body, stop, or figure out a different way to do it. Try to use your bigger, stronger joints for lifting. Carry the groceries in the crook of your arm instead of gripping the bag with your fingers. Little changes like that add up to make a huge difference.
It's such a tough paradox, isn't it? When you're in pain, the absolute last thing you feel like doing is moving. But so often, movement is the best possible medicine. In fact, not moving can make things worse. Muscles get weaker, you get more tired, but we know from tons of studies that regular gentle activity, like going for a walk or a swim, is proven to help with pain, boost your mood, and fight off that crushing fatigue. And please, remember this. You are not doing this alone. You can't. Managing this effectively has to be a partnership. You are the world's leading expert on your own body and what you feel day to day. Your rheumatologist is the expert on the disease, and your primary care doc is there to keep an eye on your overall health. When all of you are talking and working together, that's when the magic happens.
So, we'll leave you with this. Your voice is the single most powerful tool you have in all of this. Being an active, engaged member of your own care team can change the entire game. So take a second and think about what really matters to you. What are your goals? What are you most worried about? What is the one most important question you're going to ask at your next appointment to help move your own journey forward?